Budget Council has been working fast and furiously and has the latest changes that we've made. Just going to review those. Any discussion, any comments, and then vote on this.
Great. Jen Kirby, Office of Legislative Counsel. So this is draft 3.2. And I took out all the highlighting that isn't that for everything that you agreed on. So I'm just going to scroll through here, make sure I didn't miss anything. I think we're just going into the 11s. Well, 11 and then 15, 16.
11A, 11B, 11.
Just 11A. Getting close. Still just making sure I didn't miss any highlighting. That's some of it.
You have to be careful with this group,
31.
they'll find it.
You're almost there.
Yeah, we got an unfortunate random in order to here on page 29. I have that for myself. All right. And I will go through and do cleanup searching when we're done. Okay, section 11A. So this is the healthcare spending reductions. And this now has the Agency of Human Services. I made this A1 and A2 and struck B just as preview, but took some of the language from B. So the Agency of Human Services shall facilitate collaboration and coordination among healthcare providers in order to encourage cooperation in developing rapid responses to the urgent financial pressures facing the healthcare system and to identify opportunities to increase efficiency, improve the quality of healthcare services, reduce spending on prescription drugs, and increase access to essential services. Not change that list, while reducing hospital spending for hospital fiscal year 2026 by not less than 2.5%. And then this will have directed the Agency of Human Services to facilitate and supervise the participation of hospitals and other healthcare providers in the process set forth in subdivision 1 as necessary for this collaborative process to be afforded state action immunity under applicable federal and state antitrust laws. As hospital, just this is again, because we are encouraging people to come together and talk, even though this will now does not specifically authorize meeting without AHS present. But because you are authorizing participants in the same industry to meet together to come up with potential solutions to issues, it seemed appropriate to just highlight that the intent here is for them to be afforded state action immunity. All right. And then striking all of subsection B with the various criteria. So, and then just having the agency report on the proposed reductions that it has approved pursuant to this section. So it's taking out the specific criteria. So the direction is, AHS understands the purpose of this provision and the state goals. And so we'll report on the reductions it has approved, including applicable timing and appropriate accountability measures, and has that coming in monthly. Well, a gap between July and October. So that's it for that section. Do you want to pause here or do you want me to show you the one other? All right. And then the only other change is around the reporting in section, 15. So based on the conversation and speaking with the chair, it has the agency adopt an evaluation framework using an evidence-based approach to assess both the effectiveness of plan development and implementation and its overall impact. And that's it for the changes.
Right. Any discussions, thoughts, anyone like to express?
Yeah, I'll express a thought that I don't think we can really address at this point. But perhaps the conference committee would if it goes there, or perhaps we can do it, or perhaps people in the room who end up on one of these groups will keep it in mind. But we are operating here as if things are gonna keep continuing down see pathways that have been laid to this point. But the reality is that things may drastically change over the next few months, and I'm just a little concerned that I haven't seen the General Assembly exploring alternative plans, and I know it's hard to do when you don't know what's gonna happen. So that's my only concern. I'm not asking anything be added, but I'm just putting it out there. I've been thinking a lot about it. And like, I think it would be great if we somehow, maybe it could end up in the budget, maybe, but if we had a group looking at like, what would, if Medicaid disappears, if we took the percentage that of our matching money, what would we need to come up with to provide a minimum level of care to everyone in Vermont, for example, like that kind of, just crunching the numbers. I'm not suggesting we add it to the bill, but it's the one thing I just don't feel like there hasn't been a good place to fit it in this bill. And I don't see it happening, and I'm a little concerned, but hopefully we'll find a way to do work if we need to do some other vehicle. That's the one thing I would want to say. Other than that, I feel like we worked really hard on what was a framework to add a lot of pieces and settle a lot of differences, and I hope it helps.
Anyone? Come, Lori.
go ahead. Okay.
No. I'm gonna let everybody else go, and then I
Do you want to go?
Last word.
I was just gonna say thank you to you, because you really led this. This is huge, biggest bill in my 5 years. And really appreciate the impact I hope that it has on our healthcare system and Vermonters. So thank you.
I was just gonna repeat what she said. It's a good bill.
Yeah.
But I want to thank all of you. In particular, I wanted to thank Lori. The thing that I keep thinking about this bill, I will tell you, there are parts of this bill, I don't like it. We were handed something. I think we've made it a better bill. I think we've made it more focused bill. But I have been reflecting back on my very first session and the first time that I will tell you, my first moment of cynicism in my first session. And we were working on a bill, and I just absolutely despised the bill. And I got a little piece in the bill. Got a little piece around primary care. And that bill was Act 167. And I didn't like it at the time, and now I'm sitting here and we are building upon that work in this bill. And Act 167, that was not perfect. We came back the next year. We did Act 51. We are still building on Act 1. We are still making changes. Lori's entire amendment is around the accountability of Act 167. Nothing is ever perfect. A new legislature gets to come back, gets to change things. And I hope that this is a bill that people will keep working on. And I hope that it's a framework and it's not perfect. But there's enough good in here. I mean, even if you don't like anything else in this bill, just the reference-based pricing piece alone changes the game of affordability in this state. So I hope people can hold on to the good of it and realize that there's always a little bad that comes with the good, but that's why we get to keep coming back and keep getting to make changes. So unless anyone has anything else to say, I would entertain a motion.
It's thoughtful to accept all the amendments.
Thanks, Claire.
Thank you, Clerk. So
3.3. because I'm cleaning it up and I'm gonna try to get it in for a quick edit too. But
So, I'll do a straw poll on whether the committee should amend S 126 with draft number 3.2. 3.3. All in favor of amending the bill? 1100. Thank you. And
And
then,
move that the House Healthcare Committee accepts the bill as amended. S 126 as amended.
you report it favorably to that,
What's that?
that you report it favorably.
Yeah, report, that we will report it favorably with amendment.
clerk, call the roll, please.
Representative Chena,
Yes.
Representative Cordis, yes. Representative Critchlow.
Yeah.
Representative DeMar,
No,
Representative Goldman.
Yes.
Representative Houghton.
Yes.
Representative Page,
no,
Representative Powers. No. Representative Rebecca,
Yes.
Representative McFawn,
yes,
and Representative Black.
Yes.
The vote, this is favorable, on a vote of 8-3-0.
And I will be the reporter of this bill. And so it'll be on notice tomorrow. And then it'll have to go to not Ways and Means, I'm sorry, it'll have to go to appropriations. Okay? Thank you, everybody. Yeah, go
I just
ahead.
want to say, a lot of you people, a lot of these it's a lot of great work. Okay. I had trouble saying no. I hope you all come back in 2 years and say what Lori's going to tell me.
I told you so.
I told you so. So I thank everybody's effort.